All right. Good morning.
Morning.
What I have for you guys today is a video. So you guys will pay close attention.
I can't see.
Alex, give him just a minute. You weren't being patient.
Smoking causes sickness and disability, and it kills. There are more than 4,000 chemicals in tobacco smoke, 60 of which are known to cause cancer. Smoking harms nearly every organ in the body, reduces your health, and causes many diseases. Let's see how it affects the smoker. It causes oral and lung cancer and increases the risk of many other cancers. It also causes breathing problems and increases the risk of dangerous infections like pneumonia. Smokers have more of a chance of having a heart attack and are twice as likely to have a stroke. Smoking can even accelerate hair loss in men. Smoking also affects the eyes, and smokers are more likely to develop cataracts as they age. And it raises the risk of developing weakened bones or osteoporosis. Smokers tend to have yellow teeth and develop gum diseases, persistent bad breath, and other oral hygiene problems. Above all, it kills 5 million people every year and makes many more fall ill. Passive exposure to cigarette smoke also damages health. Not only to themselves, smokers also expose others to tobacco smoke. In offices, homes, and public places. Those most at risk are their own family and friends. Passive smoking exposes non-smokers to most of the same toxic gases, chemicals, and fine particles that smokers inhale. Passive exposure causes similar health effects as for those who smoke. Children are particularly susceptible and are more likely to suffer from asthma and serious lung infections. Cigarettes contain nicotine, which is highly addictive. Some research has suggested that it can be more addictive than heroin. Even if you want to quit, you may find it difficult because you're addicted to its effects. So it's important never to start smoking, as it is difficult to stop later. And if you already smoke, stop as soon as possible. Now's the time to quit smoking and tell others how to do the same. Life is better without smoke.
All right. I had another video for you guys, but for the time, I'm just going to explain what the video is about. So this video is about respiratory system, and it's basically about inhaling, exhaling, about the lungs, the trachea, and the diaphragm. So when you inhale, what do you guys do? You breathe in, and then as you exhale, you breathe out, right? Now, can someone tell me, do you know where the lungs are located in your body? Down. Yeah, inside, right here in the middle, inside your chest, there's 2 parts of it, right? And protecting the lungs is your rib cage. So, also we got the trachea. Trachea is located right here, right? That's where you swallow and you drink and all that, right? And lastly, we got the diaphragm. The diaphragm is this like little bridge around your stomach. So when you breathe, it extends. Inhale, and then when you exhale, it's smaller. So as I said here, inhale, bringing air into the body. Exhale, releasing air from the body. The lungs, main organs of the respiratory system, oxygen is removed from the air you breathe in, and carbon dioxide added to the air you exhale. The trachea is a tube in your throat that is held open by rings of cartilage. And the diaphragm, a large muscle that moves air in and out your lungs when it flexes. All right, so we're gonna have a little activity, and I'll ask Madeline to come up. what she's gonna do, I'll put a piece of paper right here. You can go move this chair out of the way. Alright, so what Madeline's gonna do is you're gonna stand there and you're gonna exhale as hard as you can to blow this paper all the way over here to the ground, alright? You can stand on your knees. Oh, she did it with one blow. Okay. Now let's see if you can back up just a little bit. As far as you can. That's good. Now try to blow that. Oh, keep blowing, keep blowing, keep blowing. All right. So, good job. Now, how many times did you inhale and exhale? 3 times, right? The second time you inhaled. And then how about your exhale? 3 also, right? Okay. Then how hard did you have to blow in the second try? A little hard, right? All right, well, thank you. You may go back to your seat. So now, I will hand out a word puzzle for you guys to do in the meantime. Put your name on it, and the date, and I will be collecting these in the end of class today. So everyone put their name and date. Okay. Do as much as you can. So how many have you guys found already? Has anyone gotten 2? All right. How about 3? Has anyone found 3 already? No? 4? 5?
0.
0. All right.
1,
1? Okay. All right. I'll give you a few more seconds. Alright, what you guys are going to do is take this home and bring it to me next Tuesday, okay? So next Tuesday, you guys are going to bring me what? This
They
paper.
won't be here next Tuesday.
Oh, next Tuesday. Okay, so would it be the following Tuesday then? Alright, so the following Tuesday, right? Okay, so let's move on to talk about drugs. Alright. So drugs changes body's functions and affects the body, mind, and behavior. Tobacco is a plant with leaves that people smoke or chew on, which is bad. Good types of drugs would be prescriptions of medicine by doctors that prescribe medicine, or over-the-counter medicine, which you could find these in stores like Walmart or Rite Aid, and these are Tylenol and Advil, which are good for you. Smoking is breathing in the smoke from tobacco or other drugs, which is bad. Also, another thing is cigarettes that slow down the beating of cilia. With cilia, what is cilia? So cilia helps push bad stuff out of your throat and away from your lungs. When you try to cough, it is the cilia working inside of you, trying to push those bad things out. So over here, I got some good versus bad drugs here. So, cigarettes, is that good or bad for you? Bad. Okay. How about Advil and Tylenol? Good. How about tobacco? Bad. How about insulin? Do you guys know about insulin? Good. How about prescription medicine that the doctor gives you? Okay. How about Dayquil, NyQuil? Good. And what about another pipe that's called tobacco type? No, right? No. Okay. So now I'm going to hand out another worksheet. And this time you guys will get in groups of 2. So you 2 here, you 2, you 2, you 2, you 2, and there will be a group of 3 right here. Alright? So here's for you 2. Here's for you 2 guys right here. For you 2. Yes, here. You and him. Alex and Kalila. Okay. Okay, and here.
So,
Alex, one for both. They're not listening.
On this paper, put your name on all the groups, alright? Put the name of like you and Alex, and that's in a sheet of paper.
Alex,
So both of you guys' names are supposed to go in the paper, okay?
Okay, Emma, you're supposed to be working with Madeline. Why don't you move your chair over there so we can Emma,
okay, so you can try all these and you
You guys know what you do, right? So you have to put these words which one is okay and which one is bad. So confidence, is that good or bad?
Just read it.
It's good. Confidence is good, so it'll be in helpful.
Science.
You guys know what you have to do? You guys know what you have to do? Okay, so you got this, 1, 2, 3, 4, 5 things, right? So here will be things that will help you and things that will harm you. So does cough medicine harm you or is it good for you? Good, right? So then we'll go down over here to the helpful drugs. And then you go so on. Aspirin, tobacco, vitamin C, and alcohol. You guys know what you're doing? Okay, good. You guys know what you're doing? Yeah? No, you just put these words right here. So cough medicine is that helpful or help? Good, so we'll go down here. Are you guys doing good? Good job. Yeah, that's right. Are you finished? Okay, if you guys are finished, I will collect them, okay? Later in class. Alright, just hold it in the desk. Okay, I want everyone to go back to their seats. Right, girls? Alright, so the next topic we'll be covering is effects of drugs of respiratory system. So addiction. Addiction occurs when someone becomes dependent or substance. This means when someone's addicted, when it's something that they cannot stop, something they keep on doing and repeating. Secondhand smoke is a mix of smoke from a burning cigarette, cigar, or pipe, and the smoke that the smoker exhales. Alright? Caffeine. A lot of you know what caffeine is because we covered this last Tuesday, right? So caffeine is the most widely used stimulant in the world. Nicotine. Nicotine is an addictive substance in cigarettes that increases levels of chemicals in the body and control how the brain works. Another one we have is smoking. This can lead to lung and heart disease, chronic cancer of any type of lung, right? So this is bad for you. And over 125,000 people die of lung cancer each year. So what I want you guys to do is in the back of this word puzzle, I want you guys to put your name and date, and we will have a little quiz here. So these are the words, right? I'm gonna read out. I'm gonna give you guys a definition, and you guys have to put whether it's nicotine, addiction, tobacco, secondhand smoke, or caffeine. So I want you to write in that paper 1 through 5. Your name, and then put 1 through 5. All right, so the first question. What is the most widely used stimulant in the world? Is it tobacco or caffeine? I'll give you two. So you have to pick between caffeine or tobacco.
Tobacco.
Don't say it out loud. Write it on your paper.
What?
The most widely used stimulant in the world. Is that caffeine or tobacco? Write your answer down. Alright, the next question is, people that are obsessed with something and they cannot stop, so they keep repeating. Is that nicotine or addiction? Nicotine or addiction? Alright, next question. This is found in cigarettes that increases levels of chemical in the body that controls the brain. Is that secondhand smoke or nicotine? It's found in cigarettes that increases levels of chemicals in the body that controls the brain. Nicotine or secondhand smoke? All right, and the last question. What causes 1 out of 5 deaths in the U.S. each year that relates to health problem? Is it tobacco or caffeine? Oh, sorry. Yeah. This is the second question. The fourth question.
What was the question?
What causes 1 out of 5 deaths in the U.S. each year? Is that secondhand smoke or tobacco? All right. And the last Question. This is a mix of smoke from burning cigarettes, cigar, or pipe, and the smoke that a smoker exhales. Is that addiction or secondhand smoke? Okay, guys. Yeah. All right. Okay, so to end it, I have for you guys a verse from the Bible. It's found in 1 Corinthians 6:19-20. And it says, "Do you not know that your bodies are temples of the Holy Spirit, who is in you, whom you have received from God? You are not your own. You were bought at a price. Therefore, honor God with your bodies." So this means your body is from the temple of the Holy Spirit, right? Your body is supposed to be clean. So you can't, be doing stuff that you shouldn't put in your body, right? Because it's bad for you. So I hope you guys have learned to make better choices and do the right thing in life. Thank you.